The mental stability of a child is a key factor in the development of a child throughout their life. Both their physical and mental health plays a part in how they interact daily. It affects the way they think, feel, and act in different situations. There are millions of children between the ages of 12 and 24 that suffer from mental health problems in the United States. The youth stage is when the most mental health disorders are detected. A mental illness is described as a disease that influences the thinking patterns, perception, and behavior of an individual. Nevertheless, more young people are being affected by diseases like depression than in previous years. Also, very common is the fact of self-harm, and many people believe that this is a coping tool for young people to handle intense emotional pain through cutting or burning. PTSD can come from many different traumatic instances in a child's life. This could be abuse, sexual, mental, or physical, victims of violence, or witnessing a traumatic event. Eating disorders are more common in girls than boys and may start in the teen years, but the number of children who develop eating disorders are small, and they can have serious effects. The prevalence rate of mental illness is very high in youth, and yet they tend to seek assistance for their ailments less than any other group. Childhood emotional and behavioral disorders are the most expensive of the illnesses. More than half of the adolescents who do not complete high school have a diagnosable mental disorder, and the students aged 14 and older drop out of high school due to mental illness. Youth who commit crimes and are placed in the juvenile correctional system has more than 70% of its population diagnosed with a mental disorder. The youth with substance abuse problems oftentimes can have a mental disorder, and adolescents with mental disorders have a tendency to abuse or experience addiction with drugs. Risk factors include, for biological factors, substance abuse, malnutrition, and genetic tendencies to psychiatric disorders. Psychological factors are difficult temperaments, sexual, physical, emotional abuse, and neglect. Social factors may include one's family, family conflict, inconsistent caregiving, and poor family management, while school consists of academic failure and bullying, and finally, community factors, exposure to violence, community disorganization, and discrimination and marginalization. In order to be diagnosed with a mental health disorder, as a youth, you must be seen by a doctor or a mental health specialist. The healthcare professional will connect the symptoms the patient is having with the recognized diagnostic criteria. Catching the symptoms early through early identification and effective intervention is key in the treatment of mental health disorders and preventing future indicators of mental health problems in youth. Medication is prescribed dependent on the patient's illness and other health conditions. The crucial part is the continuation of medication in the treatment process. Facilities that provide outpatient services are critical elements of the treatment for the patients with mental health abilities. 63% of United States counties have one treatment facility that provides outpatient and treatment for children and adolescents, and fewer than half have special programs for youth.